Welcome back to Can You Hear Me, a podcast about hearing, hearing loss, and everything in between. I'm here today with Andie DeFreese, PhD student at Vanderbilt University. Andie, I'm very glad to have you on the podcast today.
Thanks for having me. It's quite an honor.
Yeah, of course. So really just today, I want to get to know more about not just your research in hearing, but why you're doing it. So before we talk about all of that stuff, could you tell me a little bit about yourself and why you became interested in hearing research?
Definitely. So I am an audiologist and PhD candidate at Vanderbilt University. But my journey into the hearing science field really began as a young child. I was diagnosed with a profound unilateral hearing loss when I was 5 years old. And during my time growing up, I interacted with a lot of different clinicians, and I had some really positive experiences. And those experiences really shaped my interest in the hearing science field. But I also had some not so positive experiences. And that really inspired me early on to have this desire to become a pediatric audiologist. When I started my undergraduate degree, though, I fell in love with basic science. And so I studied neuroscience during my undergraduate at Vanderbilt University. And during that time, I had a wonderful opportunity to work with two mentors, Dr. Mark Wallace and Renee Gifford. And I was studying how the brain changes with hearing loss. And through that, I began to experience and work with cochlear implant users. That was my first introduction to this specific clinical population that I'd never really heard about or worked with. And that really fascinated me, this neuroprosthetic device that we're utilizing to restore functional hearing in millions of patients now. And so I fell in love with cochlear implant research and auditory neuroscience applications within that patient population. And so during my AUD, so when I was getting my doctorate of audiology, I continued that line of research and just fell in love with this intersection of clinic and research. And that inspired me to stay on even longer in school and pursue a PhD, which is where I'm at now. So I work part-time and see cochlear implant patients in the clinic. And then I'm a full-time student working on my dissertation.
That's awesome, Andie. And I'm really glad to hear that, even unfortunately that you had that hearing loss experience, that it inspired you to do all of this stuff. So I really think that's awesome because you're the first person I've talked to who has had this firsthand reason for wanting to be in audiology. I mean, obviously all of these professors have a very diverse reason, not just professors, but students for being in the hearing loss field. But this is, a unique one, in my opinion. So you kind of started to mention the type of hearing loss research you do, which you said was the intersection of, clinical and, just like the intersectional research. So could you tell me more about that kind of research and what you think your most impactful or even interesting work was?
Yeah, most definitely. I think I've had the privilege to be trained by many different clinician scientists. Even my current PhD mentor is a surgeon scientist now, Dr. Taha Jan. And it's really wonderful to see how we can use our clinical experiences and our patients to inspire our research questions. So I don't know if my work is impactful yet, but I think what's interesting to me is watching that intersection, which really kind of I got to witness when I transitioned from a basic science, neuroscience background to this more clinical translational. And I feel like I continue to try to bridge those two worlds, my background in the basic training and the basic science research that I continue to participate in, and then those clinical applications. So I think, as I mentioned earlier, it starts with those early questions. And I was studying how the brain changes with hearing loss. But by the time I became a clinical student, I was wondering how can we actually implement this into the clinic? So a lot of my early work was using a form of functional neuroimaging called FNIRS, or functional near infrared spectroscopy. It's a whole bunch of words saying that we're just using red and near infrared light to look at how the brain activates when we give it different stimulus, so auditory versus visual. However, as a clinician, I know that's not something we're going to be doing in the clinic. We're not going to add that to the audiologist's role when we're deciding who's a candidate for an implant. So I wanted to figure out how could we bridge neuroscience into the clinic, but using clinically translatable tools. And that's really what the focus of my dissertation has been. So I'm a little biased because I think that's the most interesting piece is how can we figure out how to bridge those worlds? And so for my dissertation, I've been looking at using structural MRI, which is already part of our cochlear implant workup, and genetics to try to find biomarkers of the central auditory system that may play a role in predicting how patients do with different rehabilitation devices, such as an implant. So for me, it's really this bench to bedside work. And I think what's really interesting is that even though those were my driving dissertation questions, I've also kind of gone off on what I like to call side quests during my dissertation, where I'm looking at things of how can we prepare clinics to implement this. So it's not just what are the findings, here they are. It's how do we utilize these findings and get it back to our patients as quick as we can.
Yeah, I mean, that's really interesting, honestly. And I really love how you've emphasized, not just the research itself, but translating that research into, clinical use. Because I can speak about MRI just because that's what I'm more familiar with. But there's a certain type of MRI, as you know, it increases in power with Tesla. So 7 Tesla MRI, there's a lot of studies out there that have been using 7 Tesla MRI to try and investigate the auditory pathway. But really, 7 Tesla MRI is not something that is clinically standard at all. You can't, there's not clinical centers around this country that are using 7 Tesla MRI. So to me, sitting here, it's just like, you've done all this great research. Not you, but, the people doing this research. And I'm just thinking, how on earth is that going to be translated down? That's really the important part. So I'm glad to see you're doing that with what you said, using the red and near infrared kind of light. I think that's honestly really cool. But not just, this kind of current work, but I want to talk about future work and advancements in the field of hearing loss. So as a PhD student, you really do have a lot of time left in this field. And I was wondering if there were any advancements in the field you were most excited for, or if there were anything worrying you about the future of the field of hearing loss research, if that makes sense.
Yeah, I think that's a great question. And again, I'm going to talk about my experience in the clinic and research, because one of the most exciting opportunities in our field of hearing research is gene therapy. And I've had the wonderful opportunity to be involved in a clinical trial for gene therapy at Vanderbilt, where we're working with one of the companies. And it's been a great experience, not just to learn more about clinical trials, but also to be on the cutting edge of this, changing landscape of hearing health. So I've learned a lot from that, and I find it very fascinating and exciting. But, you get into that second part of your question, is there anything that I worry about related to that? And I think that's the question of how can we, as a research community, study the broader impact of these types of treatments? So not just how are they changing the patient's hearing, but how is this affecting the rest of our central auditory system? So I think there's a lot of follow-up questions that have yet to be answered or investigated in this field. But then on the flip side, like I said, because I'm a clinician and I always think about that implementation base, goes to the question of how do we equally prepare our clinics for that transition? So for instance, I always go back to the idea of in order to refer a patient for gene therapy, we need to have a genetic diagnosis for that hearing loss. And in our pediatric population, about 50% of hearing loss has a genetic cause. However, most clinics are not routinely doing genetic testing yet on these patients. So there's this huge gap and barrier in order that we must pass in order to be able to identify these patients who could be candidates for gene therapy. So I think one of the things that worries me is if we as a clinical team don't catch up to that, we're going to miss an opportunity to prescribe the most precise treatment opportunity for our patients. So that's another arm of my research that I've been working on, is figuring out how we can better implement genetic testing within our clinical care models and practices in order to kind of give this precision medicine model for hearing loss and prepare us for this new gene therapy decade.
Yeah, that's awesome. And gene therapy really is it seems like the hottest new thing in, hearing loss research. Not even new, because it's been around. People have been talking about this for a while, but it really is, it seems to be one of the most, fields with a lot of potential. And that's why it keeps coming up in even the podcast interviews I've done previously. So just moving away from the research side of things, because I know you are also a clinician, just to wrap up our interview or discussion today with a more fun question. Could you tell me about your favorite patient experience and if that had any effect on you, or if it's something you kind of remember often?
This is a great question. Like all clinicians, I can't pick one favorite patient. I work with both adults and children, but these two examples that come to mind first are a little biased in those children. And maybe again, that comes from my origin story into hearing loss. But the first I think about is a patient who was a teenager when I inherited her and saw her for the first time. And she had had an implant for over a decade now, doing very, very well with her implant. But when I saw her, she was still kind of struggling with the idea of how can I do better, right? She's now in high school and more complex listening situations. And she just wanted to know, is there anything we can do to help her hear better? Which I think is a great question to ask, especially as a teenager. Shows great autonomy. I have had the privilege of being part of a clinical trial at Vanderbilt where we're working on something called image-guided cochlear implant programming, where we use a post-operative CT scan to get a 3D reconstruction of where that electroarray is sitting within the cochlea. And then we as audiologists use that information to selectively deactivate electrodes to try to clean up that signal. So I'd seen this patient clinically. She's looking for what's something more I can have. And so I provided her an image-guided map and I turned it on. She goes, "This sounds good." Didn't have much of a reaction. We did some testing. We saw her speech and noise scores in the booth. Got a little bit better, but there was nothing that blew us out of the water. However, she came back 3 weeks later, so I was a little surprised. I was like, okay, she doesn't like it. We'll see what's going on. And I saw her and she came back in and she said, "I only scheduled this appointment to tell you that I broke up with my boyfriend." I was like, "What?" She goes, "Yeah, he sounded like cornbread." And I immediately look at mom because I have no clue what she's talking about. And the mom just starts laughing and she proceeds to tell me that said boyfriend had a very thick Southern accent and she didn't like it. And the patient then proceeds to tell me that I sound like a Northerner and I'm originally from Minnesota. My time in Tennessee has kind of worked out my Minnesotan accent, but it's still there enough. And she was able to pick that up. And so the patient was telling me that just by providing this new change, even a decade after getting her implant, she was able to hear accents and distinguish them for the first time. So that was a really remarkable example of where I had the opportunity to translate what I'd been doing in research into a clinical patient immediately and have this kind of profound effect. And then the second patient I can think of will always hold a special place in my heart because he was my first ever pediatric patient when I first became an independent provider. And I worked with the family a lot. We were debating whether or not to get a second cochlear implant on the other side, and we decided to go ahead with it. So I saw him a lot in that first year as we were optimizing that implant. And he was graduating preschool at the time that we were kind of on our 1 year mark of being post-op from that second CI. And at that time, the parents came in and brought me a little video. And at his preschool graduation, they asked all the kids what they wanted to be when they grew up. And this little patient said that he wanted to be an ear doctor, like Dr. Andie, when he grew up. So for me, that was a wonderful, tear-filled, full circle moment of, there's a child like me who has hearing loss, but takes this as a positive opportunity. And somehow we've had a positive experience now. And, it's inspired them to want to be a part of this hearing science community.
Yeah, I mean, those are some really sweet stories on it. I couldn't stop myself from smiling, especially on that last one. I think that's very sweet. Thank you so much for joining me today, Andie. It's been great having you on the podcast, and I especially like those stories at the end. So thank you so much for sharing.
Thank you so much for having me. Like I said, it's quite an honor, and I'm very excited about what you're doing to educate others about the hearing research community and continue to be a part of it yourself.
Yeah, thank you.